My name is Dr. Mark Getelman. I'm a fellowship-trained orthopedic surgeon at the Southern California Orthopedic Institute, and I specialize in sports medicine, arthroscopic and minimally invasive surgery of the shoulder and knee, and cartilage restoration. In this video, I will be discussing shoulder instability. The shoulder has a very important role in our bodies. It's a ball and socket joint that is crucial in helping position our hands in space, allows us to put our hands up over our heads as well as away from our bodies. Shoulder instability occurs when the ball dislocates or separates from the socket. It usually occurs after a traumatic event where the ball shifts away from the socket. It is often confused, but is different from a shoulder separation. A shoulder separation occurs when the collarbone stabilizing ligaments get injured away from the shoulder blade, more up in this area here. Shoulder stability is a complex interplay between the bony structures as well as the soft tissue stabilizers. The bones and their matched curvature provide some stability to the shoulder. However, the soft tissues about the shoulder joint are equally important. There are static stabilizers, which are the labrum that surrounds the socket, and the ligaments in the front, back, top, and bottom of the shoulder. And then we have the dynamic stabilizers, which are the muscles and tendons, such as the rotator cuff and the muscles that move your shoulder blade. It's a complex interplay between all these structures to maintain stability, and this generally will keep the ball from dislocating out of the socket. When a traumatic dislocation occurs, there's injury to the static stabilizers in the front of the shoulder, damaging the capsule and ligaments as well as the labrum. Once the labrum tears, it will not heal, and this is one of the common reasons that we see people continue to have recurrent instability and additional dislocation events. In fact, the younger you are when you have your initial dislocation, the higher your chance of having recurrent episodes which result in pain and significant disability. Shoulder instability can often be diagnosed by the history of the injury and the physical exam, which demonstrates abnormal motion or translation of the ball in the socket. Additionally, X-rays, particularly from the emergency department obtained at the initial event, are very helpful as well and often demonstrate the shoulder in a dislocated position. MRI and CAT scans are often ordered by the specialist to document the extent of damage to the labrum and ball and socket joint, and these are beneficial at directing the most appropriate treatment. People who have recurrent instability complain of pain. They also complain of weakness in the shoulder. They may actually have recurrent episodes where the shoulder dislocates or pops out of position and then pops back into position. They often have a lot of apprehension about using their arm because they become fearful that the shoulder will dislocate. With each subsequent episode or dislocation, there is often additional damage to the shoulder, and this makes the potential for additional episodes of instability more likely. Initially, like most injuries, a dislocation can be treated with a sling for a short period of time, as well as some gradual physical therapy, working to restore the range of motion and their muscle strength. For the patient who continues to have pain, as well as episodes of instability, whether it's just a partial dislocation, called a subluxation, or a true dislocation, there are surgical options available. If you're under the age of 20, there's a very high likelihood that you may have recurrent episodes of instability. For those patients, we will often recommend surgical management. Most commonly, I'm able to do a minimally invasive arthroscopic reconstruction of both the labrum and ligaments in the front of the shoulder and restore the stability. Occasionally, patients will have significant instability that is associated with a bony fracture, or they've had so many episodes of instability that they've worn down some of the bone on the front of the socket. These patients sometimes require an open surgical procedure to try to restore that bony stability by using a bone procedure which widens and improves the size of the socket so that the ball cannot continue to dislocate. After surgery, you can expect to be in a sling for about 4 to 6 weeks. We start home exercises as part of the rehabilitation early on. The therapy is a gradual progression of certain motions, as there's a fine balance between immobilizing the arm to protect the shoulder and allow initial healing, but we have to understand the risk of the shoulder becoming too stiff. So if we move the shoulder too soon, we're going to put stress on the repair, and that could lead to potential failure. This fine balance has to be carefully titrated for each individual. Ultimately, it'll take 3 to 4 months till you're cleared to resume most activities. However, contact or collision athletes may take as long as 6 to 9 months till they will be cleared to go back to their contact sports, such as football, lacrosse, or hockey. At SCOE, we have developed and published advanced techniques to restore shoulder stability, and I have lectured all over the world educating other surgeons on these special techniques. I look forward to meeting you and personally discussing the ideal treatment option for you and your instability pattern. Thank you for visiting.